And we'll start it off straight away.
And a very good evening to all the delegates attending the Healthcare Revolution Conference and Exhibition 2024. I am Dr. Sivaneswaran Balasingham, the founding president of the Malaysian Society of Lifestyle Medicine and the chair of the advisory board of the Lifestyle Medicine Global Alliance. I will be the moderator for the session today, which will be Lifestyle Medicine Around the World, Global Perspectives on Obesity. I warmly welcome all of you to our panel discussion. I have with me esteemed panelists from the different regions of the world, and I would like to take a few minutes to introduce them. We have with us Dr. Elizabeth Freites, President of the American College of Lifestyle Medicine and Associate Professor, Harvard Medical School from the United States. From Malaysia, we have Dr. Kumar Subramanian, Council Member, Malaysian Society of Lifestyle Medicine. From South America, we have Dr. Sandra Lanza, President of the Chilean Society of Lifestyle Medicine. From South Asia, we have Dr. Mufida Faust, Vice President Education, Sri Lankan Society of Lifestyle Medicine. And last but not least, Dr. Emanuela Marco Hutanu, President of the Romanian Lifestyle Medicine Society, representing Europe. Ladies and gentlemen, obesity, we know, is a looming epidemic with huge health and economic consequences. According to WHO, in 2022, 1 in 8 people in the world were living with obesity. 2.5 billion adults aged 18 years and older were overweight, including over 890 million adults who are living with obesity. Today, 43% of adults over the age of 18 are overweight, compared with just 25% of adults aged 18 years and over were overweight in 1990. Worldwide, adult obesity has more than doubled since 1990, and adolescent obesity has quadrupled. Prevalence of obesity varies by region from 31% in the Southeast Asia region and the African regions to 67% in the region of the Americas. Let us explore the obesity epidemic globally, the measures that have been taken thus far, and the measures that should be integrated into our healthcare system. So let's start with Dr. Kumar from Malaysia. Dr. Kumar, according to the National Health and Mobility Survey 2023, the prevalence of obesity and overweight is now 54% as compared to 50% in 2019. Now that's a big increase of 4% in just 5 years. Now what do you think are the primary factors contributing to the rise of obesity in Malaysia?
Yes, thank you, Dr. Siva. As you can see from the statistics, the increase is quite significant. It's almost 5% increase of obesity in our population in Malaysia. Now, some of the factors that's contributing to the rise in obesity in Malaysia could be the dietary habits. One of the dietary habits that is quite prevalent now is the increase in consumption of high calorie and low nutrient foods. There have been significant rise in consumption of fast food, sugary drinks, and processed snacks in Malaysia. These foods are typically high in calories, sugar, and also unhealthy fats, while being low in essential nutrients. So this shift in dietary habits is a major contributor to the obesity epidemic. This would include the adults and also the children in Malaysia. The other is also our traditional Malaysian cuisine. Usually in Malaysia, we have roti canai or nasi lemak, either for breakfast, lunch, tea, dinner, and even supper. This popular food is high and rich in calories and fats, contributing to excessive calorie intake, which probably would cause, it definitely would cause obesity if it's taken at the improper time. Now, the other major factor that's happening in Malaysia would be the urbanization and sedentary jobs. As rapid urbanization in Malaysia has led to a rise in sedentary jobs and a decrease in physical activity. So more people are engaged in office-based works, which requires prolonged sitting and minimal physical exertion. The increase in use of motorized transportation in Malaysia, there almost middle class or even the lower middle, most of them have a transport, either a car or a motorcycle. So there's a growing reliance on this form of transportation where it reduces a lot of physical activity instead of walking or even cycling. Example is like if we were to go to a nearby shop. Those days we used to walk. Nowadays we just take a car to go to the nearby shop, which probably less than 500 meters from the house. The other reason could be also due to socio-economic factors, where the rising income levels also affords greater purchasing power of calorie-dense foods, which are often more convenient and appealing, but however can be less nutritious, especially those fast foods that is mushrooming everywhere in Malaysia at this point of time.
Yes, you're right, Dr. Kumar. I think our tendency to eat, delicious but yet very high in calorie foods like nasi lemak and roti canai, and especially we now lead sedentary lifestyle and have this rice-based meal. I think a plate of nasi lemak can easily be 500 calories, even without right? Easily, because it's for those who are not aware, it is rice that's cooked in coconut milk, and roti canai, and sometimes people have it just for a snack because they're meeting a friend. And yeah, the other thing is, according to the National Health and Mobility Survey 2023, I think the number of people who are inactive, we're not talking about exercising, but what you're saying, sedentary lifestyle, is almost, if I'm not mistaken, it's almost 50%. So, couple that with high calorie food and lack of exercise. I think 1 in 3 Malaysians don't exercise. So then, you can then see that translating into, the obesity rates just ballooning, Yeah. All right. What do you think, or rather, do you think there are any specific demographic groups that are more affected by obesity in Malaysia?
Yes, Dr. Siwa. In Malaysia, the specific demographic would depend on 3 categories. The first category is urban versus rural population. The urban population in Malaysia shows higher rates of obesity compared to rural areas. This difference is primarily due to lifestyle factors such as reduced physical activity and increased consumption of fast food, as mentioned earlier, and processed food, compared to the rural settings where they may have more natural days and they have more activities in the rural settings. The other category is gender distribution. Women in Malaysia are more affected by obesity than men, which can be attributed to cultural and lifestyle factors. The traditional gender roles may limit women's physical activities and their engagement in sports or even exercise. The third category would be the ethnic groups, where in Malaysia we have 3 major ethnic groups. They are the Malays, Indians, and also the Chinese. So it is noted that the highest obesity rate is in the Indian groups, Indian ethnic groups. They are almost at par with the Malays, whereas the Chinese have the lowest predisposition to the obesity.
Okay, so I guess when
this variation can be linked to probably a genetic predisposition as well as cultural dietary practices that include higher consumption of calorie-dense food. As you are aware, the prevalence of diabetes is more prevalent among the Indians due to epigenetic factor in the Indian population.
What are the main factors that contribute to the higher rate of childhood obesity in Chile?
Good morning. Thank you very much for this invitation. For me, it's an honor to be present in this forum, sharing with such wonderful people, and also for the opportunity to represent Chile, South America, and lifestyle medicine, Chilean Lifestyle Medicine Society. Which are the principal factors in Chile? In Chile, there are multiple factors that contribute to a childhood obesity. Firstly, there are social and cultural factors, change in eating habits with a high increase in the consumption of ultra-processed foods and sugary drinks. This can also be linked to gender roles in food preparation, where women are primarily responsible to family meals. Typically, they are the ones who buy, organize, and cook food. However, it to be noted that many women have double working hours, which can limit the time available to prepare healthy meals. Consequently, they often opt for quicker and less nutritious options. Secondly, in terms of environmental factors, for example, the lack of safe public spaces for physical activity, especially in urban areas. Additionally, there is a lack of public policies and state investment to promote exercise and sport for everyone. Thirdly, there are also educational factors such as insufficient nutritional education from early stage of life, both in school and at home. Furthermore, the limited hours of physical activity in schools contribute to a sedentary lifestyle being predominant in Chilean reality. And lastly, there are economic factors. Many times people tend to choose unhealthy options since they can be a cheaper, easier, and faster options. However, we know that it's not true. There are evidence that show the opposite, but we must consider that there are food deserts where there is really no access to healthy food.
Okay, so as I understand, one of the practices is that women being involved in the workforce also contributes to the fact that lack of time, sort of facilitates, how would I say, unhealthy food choices. Now, I suppose that probably is a global issue. I think it happens in Malaysia too. So people tend to buy unhealthy food outside. And I'm sure it happens in the United States as in other countries, all right? So, I was reading that due to the alarming increase in childhood obesity, Chile introduced some very interesting public policy strategies. Could you explain a little bit about that, please?
Yes, the main strategy implemented in Chile is a law that establishes the front labeling for food, which involves the introduction in warning levels on foods that contain added sugar, sodium, and saturated fat. This has increased awareness and changed consumer choices. However, it does not consider the level of processing or the amount of fiber in a product. Also, selling this labeled food is banned in school. Additionally, this law includes restriction on the advertising of unhealthy food directed at children. These measures have shown an impact on decision to buy labeled food. However, there has been no decrease in the percentage of childhood obesity. On the contrary, the rates remain high and increasing.